But if you do want to be world's best, then you've got to actually be prepared to change. And the only way you can change is to get people into a room and talk about it, make people aware of what's new in the world, the latest research, and try and educate people so that they can then come up with solutions.
Well, being at this conference is a really fantastic opportunity for me to connect with health leaders throughout the country.
It's always great to be in Australia, and I think your sense of pioneering spirit and your sense of curiosity and your sense of self-reflection mean that conferences such as this are always very productive.
We have a chance to hear from different perspectives, and I think what's really important is to understand that to learn and make improvements, sometimes we have to learn to see things in a different way. So if we only come at it from our own cultural lens and are closed to everything else, then we're always going to see things the same way.
So there's a lot of people in the room who carry a lot of influence, and for me it's a great opportunity to tell them about this story, to see if they will endorse me, to see if they will continue this conversation going.
In the last few hours that I've been at the conference today, it's quite clear that people feel there's a lot to learn from elsewhere in the world. There's a lot to learn across different states, and there's a lot to learn within states as well. So I think the benefit of these sort of conferences is to, one, disseminate knowledge, secondly, to reflect on your own practice and other people's practice, and thirdly, I think most importantly, is to take a renewed sense of purpose and energy away from the conference to put into practice. And I think I've seen all of those things today.
These kinds of international opportunities allow us to learn from others and recognize that maybe the way that we look at the world isn't the only way that we should be looking at it.